Hi, I'm Dr. Stephanie Gunderson, and I'm a fertility specialist here at Froedtert Medical College of Wisconsin. One of my specialties is meeting with and offering treatment options for fertility preservation in patients that have a new diagnosis of cancer. I want to utilize this video today to allow you the opportunity to hear your options for fertility preservation. We will discuss sperm freezing, egg freezing, embryo freezing, and medical ways that we can preserve your fertility. I want this video to facilitate discussion with you and your oncology team. This is not meant to replace a referral with myself or one of my colleagues, but I do want you to understand what options you have so that if you think a referral is appropriate for you, that you ask your oncology team to place one so that you can meet again with myself or one of my colleagues. Patients who are undergoing cancer therapy oftentimes undergo radiation or chemotherapy. Both of these treatment opportunities target rapidly dividing cells like cancer cells. There are rapidly dividing cells that are normal cells within our body, and some of those cells are in the sperm and testicle and within the eggs and the ovary themselves. This is how cancer treatments like chemotherapy and radiation can impact egg and sperm numbers. The first thing I want to discuss is sperm freezing. Sperm freezing is done in our facility at the Reproductive Medicine Center at North Hills Health Center. Sperm can be collected either in an inpatient setting and be couriered over to our facility. It can also be collected at home and brought to our clinic within an hour of collection. Alternatively, it can be collected at our facility in private collection rooms. The sperm is then analyzed and frozen for later use. Andrologists, who are important members of our laboratory team, will assess the sperm for its viability and freeze the sperm that day. They will then call you with what opportunities will be available to you for future use. Next, I want to discuss egg freezing. Individuals who are assigned female at birth have the opportunity to freeze eggs. As females, we are born with as many eggs as we are ever going to have. We go through them as we begin to menstruate, and by the time we have reached menopause, we've essentially run out of those eggs. Any type of chemotherapy or radiation can impact those number of eggs that we have remaining, leading to infertility post-cancer treatment. Egg freezing is an opportunity that individuals have here at the Reproductive Medicine Center at North Hills Health Center at Froedtert Medical College of Wisconsin. Egg freezing is a process. It requires 10 to 14 days of subcutaneous injections, which means underneath the skin of the abdomen, that an individual administers themselves at home. During that 10 to 14 days, that individual is in our office almost every other day for an ultrasound, watching those follicles, which are the houses of the eggs, grow and having blood work done to watch their estrogen levels rise. It takes 10 to 14 days to grow those eggs to maturity. After those 10 to 14 days, individuals undergo an egg retrieval. Egg retrievals are done here at the North Hills Health Center at the Reproductive Medicine Center with anesthesiologists from the Froedtert Medical College of Wisconsin that come to put you to sleep. You will not remember or feel anything. Ultrasounds are done that guide a small needle through the vagina into the ovaries and aspirate those eggs. Any mature eggs that are available and retrieved will be frozen for your later use. Alternatively, individuals do have the ability to create embryos after those eggs are retrieved. Sperm from either a partner or a donor can be used to fertilize those mature eggs and create embryos that can be frozen for later use. Last, I do want to discuss medical opportunities available for fertility preservation. This is another opportunity that is available to individuals that are assigned female at birth. This is a subcutaneous injection, again, underneath the skin of the abdomen, that is given monthly to suppress ovarian function, so suppress egg development and suppress hormonal development, as well as to suppress menstrual cycles from occurring during treatment. This option essentially quiets the ovary, therefore decreasing the blood flow that the ovary sees and theoretically decreasing the exposure that the ovary has to chemotherapeutic agents. There is data suggesting that this option is not our best option. Sometimes it's our only option, and if that is the case, this might be the right treatment option for you. However, I do always recommend that patients consider egg or embryo cryopreservation as well. As this video concludes, I hope that you learned about your opportunities for fertility preservation. I hope that this video allows you to facilitate a conversation with your cancer care team and discuss whether or not one of these opportunities available is right for you. If you feel that this is something you would like to proceed, please ask your oncologist or a cancer team member to place a referral for reproductive medicine to discuss these opportunities in more detail. Thank you for watching our video.